Good morning, and thanks for joining us today. Welcome to the Art and Social Activism Online Festival that's been taking place since April 15th up until tomorrow, I think, is the last event. My name is Amanda Suarez. I'm the gallery manager at Fountain House Gallery and Studio located in Hell's Kitchen, and I'm honored to be here today moderating today's town hall, where we're going to be talking about the organization we come from, Fountain House. We're going to talk about mental health, COVID-19, and art. So with that introduction, I wanted to quickly introduce our panelists today. Jason, if you wanted to say a quick hi and tell us about yourself.
Yeah, thank you. Hi, everyone. My name is Jason Bowman. I've worked for Fountain House for about 20 years, developing and building a variety of programs with the organization. I'm also the former director of Fountain House Gallery.
Thanks. Susan Spangenberg and Isa Ibrahim are the artists joining us today who are members of Fountain House Gallery. If you guys want to say also a quick hi to everyone.
Hello, everybody. My name's Isa. I'm an artist at Fountain House Gallery, and I've been painting all my life, and I'm very excited to be here today.
Hey everybody, my name is Susan Spangenberg, and I'm also a proud artist at Fountain House Gallery, and I too have been painting my whole life.
Thank you guys. I will also mention quickly that throughout the panel, if you guys have any questions for us, feel free to add them in the chat and we'll do our best to get to some of those questions at the end. So I thought we would start by talking about what Fountain House is. So I'm going to give just a quick brief history and background. So in the 1940s, there were these patients from the Rockland State Hospital that would get together and write, share poetry, make artwork. And this club they called We're Not Alone. And it was a supportive environment where the patients would go and participate in these different social functions. So when they were let out of the hospital, they would still meet by the steps of the New York Public Library with the idea that what they were doing would help combat the stigma surrounding mental illness and ideally change people's perceptions surrounding that. So in 1948, then they were actually able to purchase a building, which is where we're still located today in West 47th Street in Hell's Kitchen. And that's kind of how Fountain House began. So I thought, Jason, if you could tell the followers a little bit about the mission of Fountain House and go into a little further detail about what we do.
Yeah, sure. Again, welcome everybody. I'm so happy to take part in this. As Amanda mentioned, Fountain House has been open for 72 years, and it's dedicated to the recovery of men and women living with mental illness. We provide resources and opportunities for our members to overcome social isolation and build the community and resilience they need to thrive. We work with about 2,000 people annually in New York City by engaging our members through a variety of innovative work, education, clubhouse, and social programs. In fact, the Art Gallery is an amazing example of a social cooperative we created that is now the premier venue in New York City for artists with mental illness. No one actually lives at Fountain House proper, to be clear. Rather, hundreds of members voluntarily come in on a daily basis to contribute their time and talents, and in return receive support services. Fountain House has become the most widely replicated community mental health model for people living with mental illness. Today, more than 300 such programs serve over 100,000 people in the US in more than 30 countries.
Thank you. And also, I have another follow-up question for you, actually. So how much, just so we can also inform our viewers, how much of the work of Fountain House is about reducing the stigma associated with mental illness? And how was this already a major health crisis before the pandemic of COVID-19?
Yeah, I mean, our members reduce stigma every day by going to work and by going to school, by building businesses, as well as becoming advocates and activists and artists, just by contributing to society, by being visible. They're showing the world that with proper treatment and support, they're like any functioning member of society. They're our coworkers, they're our friends, and they're our neighbors. Of course, breaking the stigma has always been an important goal for Fountain House. We produced a number of campaigns and events aimed at doing that. One of the reasons we opened up Fountain House Gallery is to use art as a vehicle for breaking stigma. And our artists not only, make and talk about their art, but they run the operation of the gallery, which is open to the public, 6 days a week.
We definitely could not do it without them. I can tell you that much. And just revolving COVID-19, obviously this is a global pandemic we're experiencing. What has Fountain House been doing in response to it?
Yeah, I mean, social distancing strikes at the heart of the Fountain House model. We know that social connection is vital for people in recovery, living with mental illness. When COVID hit, we adapted our model to maintain connection. So we're using a variety of tools like Facebook and Zoom and Slack to connect, meet, and organize. We're also delivering meals, medication, technology to meet the basic needs of about 200 of our members per week. We have dozens of virtual social recreational opportunities each week to prevent social isolation and loneliness. We operate a 24-hour warm line where members can reach their peers, the peer counselors, for emotional support. And what we needed to act fast to close the physical clubhouse. It was the first time we did it in our 72-year history. While we had to close physically, we were still deemed an essential service by the city. So we really needed to act fast.
And I do want to also add, despite, of course, the social distancing and isolation, kind of like you said, going against our model, I feel like using this virtual platform now has also allowed those members who may have struggled in the past, getting out of the bed and getting out of the house and walking into Fountain House. I feel like we've been able to reach them now with all of these virtual platforms we're using. So that's actually been kind of nice to hear how we've been able to engage people that were struggling a little bit before. So.
Yeah, I mean, I would say like half the membership did not either have access to the technology or felt comfortable using the tools. So, like I mentioned, we were able to purchase Cricket phones and other telephonic devices to deliver to them, and then really, safely teach them how to use it so that they can stay connected as well. And the other half, even that were technologically savvy or had access to the equipment, I mean, it was a learning curve to learn Slack. I don't know if everybody even understands what Slack is, but it's a working tool that's used mostly in corporate America to really organize work. And work is such a central part of Fountain House's model to give people meaningful work to do during the day to, again, prevent isolation, to prevent a feeling that they are not, being productive. That it was just really important for us to kind of utilize the tools that are being used, for work across sectors.
For sure. So I did want to segue a little bit to talk about the gallery. So just a little bit of history in the gallery. We have so many creative and talented members at Fountain House, and it was noted the need to provide a space to show this talent and the artwork the members were creating. So in the year 2000, the gallery was born. Also in Hell's Kitchen, it's actually just down the street from Fountain House. So it's another supportive environment for the members to showcase their work. And we see the gallery first and foremost as a community art space where we encourage our artists to create, exhibit work, and build kind of their confidence in seeing that their artwork, has value, and kind of helping them see that the art making is a vocation of theirs. So we try to just help the artists grow artistically and professionally by providing these resources and maybe showing at other galleries. And we also actually have, before I forget, a studio in Long Island City that we were able to open in 2017 now. And that's located in Long Island City, where we provide just another nice environment and supplies and materials for the artists to work. And, like Jason said, again, this loneliness and the social distancing, again, goes against what Fountain House is all about. So the gallery's response to COVID, we've also been using Zoom a lot. We've been hosting studio sessions virtually about twice a week, and we get together with a prompt and make some artwork. And this is normally followed by art critiques and discussions. We also have our weekly gallery meeting through Zoom, updating the artists on deadlines, different call for works, and any other announcements they'd want to share. And we're also providing, art supplies for those members who may not have a lot to work with in their homes. So we're having those shipped to them so they can work. So all of this, along with the other events and activities Fountain House has been planning, or have been nice ways, I guess, to kind of cope and stay connected during this time. So I wanted to also, Susan and Issa, since you guys are artists of the gallery, whichever of you who wants to go first, if you could just tell us, when you joined Fountain House and the gallery, and how has that experience and being part of the community been for you?
Yeah, I've been aware of Fountain House and the gallery since maybe the early 2000s, when I was an inpatient at a psych center in Queens. And there was an art program at that psych center, and that became my go-to place to do art. And somehow, through circuitous means, I met Jason, who was the director of Fountain House Gallery. And he came to that art program, and we struck up a friendship, and he even let some of the members of that art program into the outside art fair through the back door, which was great because it was a wonderful experience to be a part of that very burgeoning art scene that was going on in terms of outside art. And then I just was doing a couple of shows with the gallery as in connection to that art space. And then sometime a couple of years ago, I finally became a member of our Fountain House Gallery, and it's been very enriching and very rewarding. And I feel like it's a natural extension from doing the work in a studio to then coming to a professional gallery. And like Amanda said, continuing the vocational curve of becoming a professional artist. Being on Artsy, the site for having your work listed for being in galleries and for sale after it's been at a show. And so it's just been a wonderful experience for me.
Yeah. Hey, I'm Susan, and just to piggyback on what Issa said, I agree that it's, the Living Museum is on the grounds of a state psychiatric hospital. So Issa and I met as inpatients at Creedmoor Psychiatric Center, and we were also artists at the Living Museum. But what I love about Fountain House Gallery, it takes it a step further and invites you into the community and treats you like a human being. So it's actually, it's actually the model for where, like, I think all the art studios need to go, and all the art communities need to go.
And I think you guys have some artwork.
2015.
You
Yeah.
what? Sorry?
I joined in 2015 officially.
And you guys have some artwork you'd like to share, right? I'd love to see something.
What you see in the background there is this piece here. It's a collaborative piece, and we don't often collaborate very much, but this one, Susan did like the background and was kind of like finding her way, trying to put placement, and I just did the foreground with the images and the figures, and it's called Can We Flee from the Mess You've Made? And it talks about climate change, the world on fire, and some racial issues, and the issues with the animals being taken advantage of. And it's a very dark piece. It came to both of us from a very dark place that we discovered we were in as a society earlier this year. And then then COVID happened. So it's almost prophetic in an interesting way. Mm. And then there's this piece that Susan did, which she can talk about.
Yeah, this piece was in response to the doctor at Elmhurst Hospital. When Elmhurst Hospital is like 10 blocks away from where we live. Yeah. And as you know, it went viral through the New York Times. And for some reason, I started doing the birds green, teal green, because I was thinking about the scrubs that the doctor was wearing and all the healthcare workers. So I kind of did that to honor them. And then you have, New York City iconography of the coffee cups and the bagels and the cabs. And I'm a native New Yorker, so, I have to give a shout out.
And those are things that we take for granted as New Yorkers, the coffee and the bagel and the taxi cabs, until they shut things down and almost miss those things. So it's interesting.
Thank you, guys. So would you say you normally work painting or?
Yeah, I'm a painter primarily. I work in a lot of different mediums. I've done sculpture, I do sketches, I've done comic strips, but I'm primarily a painter. And so it tends to come out best in that format for me. Susan works in many different mediums as well. But how would you?
Yeah, I guess. Yeah, I look at, I don't look at art in terms of categories. I feel like art is just, it's so varied and all interconnects. And I think all forms of writing and art and music, and they're all interconnected, even if you're not selling at a gallery, you're just like sitting home and you're writing your thoughts down, like that becomes very artistic. And I think it's a time now for all of us to kind of express ourselves, because it's certainly helped me, and I think it helps all of us on some level to express ourselves.
Yeah. And one thing I have heard from a lot of the other artists in the community is that initially with this whole COVID thing, we were frozen in a way. We couldn't do anything. I know I couldn't do anything. I was talking to other artists saying, no, I'm not really motivated, because it's such a shock to the system to all of a sudden be in quarantine. Mm-hmm. And not get anything from life, not get any kind of juices from walking around, experiencing life. But slowly, I think I found that I'm creating more and getting into the swing of it, or getting used to this quarantine now.
Yeah, I think at the start, like you said, it's kind of a shock, but then your body kind of asks for it again, because it's so used to you creating that at some point you're just gonna start again.
Yeah.
Thank you, guys.
Issa, I have a question. Susan and Issa, how often do social justice issues play into your work? I mean, when you're creating art, is it important for you to express your position or help people think differently about social justice issues when you create art, or are there other intentions when you're creating?
Well, I can speak for myself in that it's a natural part of my creative process. It's a natural part of my thinking process. As a Black man in the system, I can't help but somehow express something, some kind of social consciousness, So even when I'm not even intending it to come out, it bleeds out in certain ways,
Yeah.
And I think that's important, to always be mindful and always, if you can, make other people, not make, but try to help others be mindful of the social situations we're living in that could use some change. And this is this season and the last couple of years have been big for change, almost like we're begging for it.
I don't always, for the most part, I don't set out to do any kind of social political work, but I noticed that I happen to do a lot of work based on my experiences with living with mental illness. And a lot of people forget that, mental health is a social political topic. So, we often forget about adding that to the list.
Yeah.
And so in that respect, even when I think, I don't set out to do it, I'm still doing it, because all art is just a reflection of yourself anyway in society, as you know. But certain things have come up in my work, being a woman of color, half Indian and the other half is German, being an American, being a New Yorker. Those are the things that I identify with. So, and being a person with mental illness. So.
Yeah.
Well, thanks.
So we have been seeing a fair amount of attention being placed on mental health during the COVID-19 crisis. And, Fountain House, as we mentioned, focuses on adults who suffer from severe mental illness. So, Jason, we were wondering, are we seeing the pandemic and isolation exacerbating cases of mental illness that may have been less severe or gone undetected before this time?
I mean, there's certainly a second, mental health pandemic happening, if you will. There's been a broad body of research that links social isolation and loneliness to poor mental health. There was a recent Gallup poll suggesting that people are suffering more with their mental health than they are at this point with their physical or financial health. But there are many factors that make someone even more vulnerable or prone to decompensation because of this crisis. Age, income, we're even seeing what neighborhood you live in, factors in, and certainly, mental health diagnosis. If someone has a diagnosis, whether it's, officially diagnosed or undiagnosed of a serious mental illness like major depression, bipolar disorder, or schizophrenia, this crisis can certainly have a greater impact. I mean, this is why Fountain House sprung into action like we did. We didn't want physical distancing to lead to social isolation. And because of that, we've had less than 5 psychiatric hospitalizations since closing down, and that's out of 2,000 people. So, I do think that there, like I said, is, thank God there's a lot of attention being paid to mental health. And it's not just all on the economy. But obviously the physical effects are devastating as well. But I think that people are talking about mental health a lot more during this pandemic, for sure.
And so, according to a Healthline article published in April, people already suffering from severe mental illness with pre-existing conditions are more at risk of contracting the COVID-19 virus. And in another art and social activism town hall that was hosted a few days ago, it was mentioned that there's a disproportionate rate of infections also among minority communities. So there seems to be a lot of vulnerable populations, including like the LGBTQ community, for example, and groups of people who are struggling during this pandemic. I don't know if you wanted to shed a little bit of light, or what are your thoughts on that?
Yeah, look, I don't think that there's one factor that indicates, why vulnerable populations are more prone to contracting the virus. For homeless people or prisoners, it could be that they live in denser environments or can't socially distance properly. People of color are more likely to be frontline workers, we're finding, and are at higher risk of exposure. People with mental illnesses are facing physical health vulnerabilities due to side effects of their meds or like comorbid, health conditions. Sometimes our members have to risk their physical health just to see their psychiatrist. I know Issa and I were talking about that yesterday. He can, chime in on that. Others may choose not to report COVID symptoms at all, over fear that if they get that they might get hospitalized for psych reasons, because yes, there's stigma in the hospital system too.
Yeah.
Issa, do you want to chime in on your, on your experience?
Just last week, after a whole month, I get a monthly injection at my clinic, and even my therapist contracted COVID, and I was staying away, but I had to go in for my shot, and I took an Uber as opposed to the subway, but I was there for my shot, and they were there all suited up in their hazmat suits. The nurse was ready with the injection, and it was disquieting very much just to go in there in the close quarters and come out of my hovel for a little while, and venture out into the big city. But you have to get your medication. That's the most important thing in order to keep your mental health in order to be stable. So that was like a no-brainer, really. I had to go and get my medication, but it was challenging. And my therapist at the time, when I was talking to him, he said a lot of people aren't coming in for fear of catching the COVID. So there may be a spike at some point of people maybe being rehospitalized or having to find an alternate route to getting their medication. But I knew I had to go and get it. So it was scary for me, but I ventured out.
Yeah.
That's pretty incredible.
And you know, as I mentioned, you know, and before, I mean, we had a member last week who was experiencing symptoms of COVID, had a fever, lost his, you know, sense of smell, went to the emergency room, and when they found out he had a psychiatric diagnosis, they sent him to the psych ward. I mean, that's, you know, that's an overtaxed system making, you know, a snap judgment, but it's a judgment based on stigma. So there's all these factors that play into, you know, the vulnerabilities that people are really facing in this crisis, and you know, the kind of inequity in our society. It's always been there. You know, it was there before COVID. It's just really showing its ugly face right now.
Right. Thank you, guys. So a question for Susan and Isa. The National Association of Mental Illness has said that maintaining a routine, practicing mindfulness, and following your regular mental health treatment plan, among other suggestions, are ways to help with protecting your mental health. What do you think about this? And as artists, how would you say is your art making helping you, or just art in general? How do you think it's helping everyone during this pandemic?
Well, I definitely agree. I don't often agree with NAMI, but I definitely agree that maintaining a routine is good. Just getting up in the morning, brushing your teeth, showering, doing your laundry when you can, finding little tasks that you can perform during the course of the week to look forward to. It's very important to do those things, just to keep a sense of normalcy within this abnormal situation. And art also, we have art all over the house, and Susan's constantly creating. So it's helped just keep things stable within this unstable situation for us. Staying connected to the gallery. These Zoom sessions have been a godsend, really. You know, staying connected to our friends in our community.
Yeah, you know, art has always just been a tool for me to cope with my symptoms. So that my art and just I have a wonderful therapist that I've been seeing for the last 10 years who saved my life. So just, you know, having to adjust to Skype has been difficult, but we Skype twice a week, and I'm very lucky and fortunate to have found somebody that I click with, because it took me maybe 25 years to actually commit to therapy, because I just didn't sit well with the kind of services I was getting in the system, and I had to go outside the system and pay for like a sliding scale therapist that was willing to work with me.
Mm-hmm. Would you say you guys are, I mean, I guess it's hard to tell, but you know, without being able to go outside and different activities and events to go to and stuff, would you say you're maybe like making more artwork than before, or?
No, you know what? The thing that, you know, that I would say, and also like we've talked to other artists at through the gallery, through Zoom, and I've heard a lot of other artists say that, you know, I used to isolate myself before this, so
Yeah.
so in a way, and I'm used to being locked up, so I know what that's like and stuff like that. So in one sense, you're kind of used to it, like being away from people and people not wanting to touch you and being afraid of you when you're, you know, melting down or breaking down all these words you hear, these phrases you hear, you know. So we're kind of used to that, but at the same time, like, it still affects us, even though we're kind of used to being outed and isolated. And Fountain House helps to bring people together. And for the artists at the gallery, I know that I speak for a lot of artists who some of them don't feel as comfortable going to the clubhouse. So the gallery and the studio have been a godsend to us, because it's a way for us to connect still at Fountain House, but in a different location.
Yeah, I think there's different, you know, there's these different what we call units at Fountain House, right? And there's different, you know, daily tasks and work that the members can like help the staff with. And I think it's really up to, you know, each individual member, like where they want to participate. And for a lot of the members of the gallery and studio, it's through the art making. So I think, you know, with the opening of the gallery in 2000 and of the studio, it's been, I think, and I'm a little biased, but it's been a nice addition, right, to kind of fuel that creativity and provide a different kind of space for the members to kind of, I guess, just help, you know, with just day-to-day life and stuff.
Even though I love the Zoom sessions, I really do miss doing my gallery hours. I felt such a tremendous sense of pride coming into the city. It was like, it was my job, you know, coming to the city and sitting with the gallery for 2 hours or 3 hours or 4 hours and representing the work, not just my work, but knowing a little bit about most of the artists and the work. And if someone would come in, I'd chat them up, or I just get the engagement. I miss that engagement, you know, and so.
And having the keys to open the door and being responsible to lock the door and handle money and things that they usually mentally ill people, you know, you're not given the keys to a gallery in Midtown Manhattan, like a store or something. So, and also, like, I want to say about Fountain House, I only have wonderful things to say about Fountain House. And I remember, like, lots of people would be like, oh, I want you to talk about this or that, whatever. And I'd say no, because, like, it has to be genuine that, you know, I'm only going to give shout outs to places that have actually helped me. So I remember when I first came to the clubhouse, I went to the unit, and, you know, after my tour, and people were looking at me in the eye, and that was like 20 years in and out of mental hospitals where nobody was giving me eye contact, you know? And for the first time I walked in there and I just couldn't believe how people were looking me straight in the eye. And it wasn't something I was used to, you know? So, I mean, I didn't even get that from my parents. It started with my parents treating me that way, and then the system, you know, further, you know, abusing me and traumatizing me until I went to this clubhouse where people were just there with open arms, and it just brought tears to my eyes, you know? And then I went to Fountain House Gallery, and I remember just like sitting in the corner, and Ariel Wilmot was the director then. And I was just kind of like, you know, you're used to, like, because when you're locked up and you look at somebody in the eye, it's considered like you're going toe to toe with them, like a threat. So often the psychiatrists and nurses will look at you like, what, you want to start something, you know? So when I went there and Ariel, you know, saw me in the corner, and she just extended her hand like this, like for me to take it and shake her hand. And that just started a friendship and a relationship for the next 5 years that just like really encouraged me, like, to have a voice, you know, as an artist, and to feel like a human being, you know, to be valued. And really that's what Fountain House does for people.
Yeah, there's a sense, you know, of deep connection that we make in this organization. And I think, you know, compared to my previous jobs, like, it becomes so personal because you become so close with the people you work with. And, you know, we're all working here, we're all members of this community, and, you know, we're all aiming with this one mission to break that stigma that people even today are still facing. So it's kind of a proud moment to be honestly working for an organization like this and seeing, you know, how steps we're taking to kind of, again, you know, change people's perceptions. So
I like to think we're also bringing some warmth to the art world, which tends to sometimes be cold and uninviting. So,
100%.
You know, you know, people enjoy coming in. You know, we have a storefront, you know, gallery right on the corner of 48th and 9th in Hell's Kitchen. People enjoy, you know, just like coming in and really, you know, us being authentically there to explain the art and talk about, you know, and people can obviously purchase the art as well, so they can take it with them.
So I do have another question, and, you know, Jason or Susan or Isa, whoever wants to chime in first. Do you think that the pandemic and the attention it has brought to mental health will help reduce the stigma and make people more comfortable seeking help? What do you guys think?
I feel like this pandemic one thing that I think the one word I've seen, or several words I've seen bandied about, is stir crazy. You know, everyone's feeling stir crazy and feeling that cabin fever of being quarantined and locked in. And so it's almost like a normalizing of a certain type of ambient mental illness that most people are starting to feel or have felt. And so hopefully this experience will create a sense of empathy or sympathetic resonance for people who have been locked up in a hospital or have felt isolated or have felt in some way marginalized, or maybe this will kind of create a dialogue, because you know we're all feeling it. We're all feeling that feeling. So.
Well, I think Susan mentioned too. I mean, she's, you know, she had experienced isolation. I think everyone is experiencing the devastating kind of negative effects of isolation. And that's an experience that all too often is had by people with mental illness. Right. So yeah, you're right, Issa. I mean, maybe there will be some empathy. I think regardless, I think as we come through this crisis and people are getting mentally and physically healthier, people will start to talk more about their experience. And I think that can only be a good thing.
Well, this has been a general trauma, a global trauma.
Yeah.
So there may have to be a global therapy or several therapy sessions of sort, you know, a sort of global coming together and decompression. And wow, what was that? Remember that?
Right.
Yeah. So.
You know, mental health is not going out of business. So that industry's strong.
So I will also quickly mention in the chat for everyone listening, I copy pasted a couple links of resources, including the Fountain House website. So if you just go to fountainhouse.org, you can learn more about what we do. And I wanted to open up a kind of Q&A with the audience today. So again, if you have any questions, feel free to just put them in the chat. We do have a few comments I thought I'd share about how beautiful, Susan and Issa, your work has been. So if you read the chat, it's really nice. We do have one question from Sarah Sloan, and she asks, what can we do to help Fountain House and its members?
Well, I mean, we're a nonprofit, so obviously, you know, donations are always welcome. And you can make a donation right through fountainhouse.org. Also, as I mentioned, the artwork is for sale at the gallery. All of our artists are, so the gallery has a separate website, which Amanda, if you want to put that in the chat, you know, that will give you an idea as to kind of, you know, how many artists we represent and the different types of work. All of our artists have a page on Artsy as well, or most of our artists do. So you can purchase art right through there as well. So yeah, purchasing art, making a donation. Obviously, when we're open, we would love to have you come by, and the address is right in the Fountain Gallery website.
Don't forget social distancing though when you do come down.
Yeah, right. We're not sure what the rules are going to be.
The elbow rub.
Yeah, it'll be interesting to see, I guess, just
about that.
in general, how will they just reverse how we started working from home, or how, you know, what protective measures the city and just everywhere will take to make sure there's not another spike, right?
Yeah.
Cool. Well, I don't know if there's no other questions in the chat, so I guess we've been very thorough. There is someone, let me just read this real quick. Someone saying that they're very impressed with Fountain House. Thank you.
Clear.
Very nice comments. Thank you, everyone, for sharing. I guess if there's no other questions, I wanted to thank Nicholas Kahn for inviting us for this panel. It's been a pretty great way to start my day, honestly. And thank you for Jason and Susan and Issa for sharing your input and just being a great fellow panelist. So I appreciate everyone. And thank you for the people for joining us, and we'll see you soon, I guess.
Be safe, everybody.
You
Thank
too.
you.
Bye.
Bye-bye.